So we're going to go through the bones and markings of the upper limb, starting with the humerus, the upper bone. We have the head of the humerus, and then right below the head we have the anatomical neck, and then here would be the surgical neck. We have two tubercles. A greater is the larger one, lesser is the smaller one. Intertubercular sulcus is between them. Then some quizzes won't have it, or if they do, we do have the deltoid tuberosity would be right down here with the radial groove running beneath it and the posterior side, but you may or may not have that in your quiz. Going down to the distal end, we have the capitulum is the rounded process, and the trochlea is, it looks kind of like a spool of thread. Trochlea means pulley, so it looks like a pulley. And then we have a medial epicondyle and a lateral epicondyle. And then we have some fossas to worry about. And remember them based on what articulates with them. So if we close the arm, this fossa right here is articulating with the coronoid process. So that makes it the coronoid fossa because it articulates right there. Here, above the capitulum, articulates with the radial, the head of the radius, so it's the radial fossa. Turning to the posterior, we have a fossa right here that articulates with the olecranon process, which makes this the olecranon fossa. Moving down to the lower arm, we have the radius and the ulna. The radius rotates on the capitulum here, and then the ulna is the more medial one. Starting with the ulna, we have the coronoid process. In here, we have the trochlear notch, and then back here we have the olecranon process. So you can maybe think of it as a mouth where the upper lip is the olecranon process, the inside of the mouth is the trochlear notch, and then the lower lip is the coronoid process. Moving down, we have this right here, this notch. It's the radial notch because the radius articulates there. So it's on the ulna, but it's the radial notch. Moving downward, we have the styloid process, is the sharp little pointy part on the distal end of the ulna. Going back up to the radius, we have the head of the radius, the neck of the radius would be right below it, the radial tuberosity, and then moving distally, we have the ulnar notch would be the notch where the ulna hits on the radius. And that's it for the arm. Then we have the carpals. So you can orientate it based on the pisiform is seen on the palm side. So you can know that this is anterior and this is posterior if you find that pisiform bone. So starting laterally, if you use the mnemonic, some lovers try positions that they can't handle. S is scaphoid, L is lunate, T is triquetrium, which is underneath the pisiform. Pisiform's on top. Going back up to the distal and lateral, we have the trapezium, the trapezoid, the capitate, and the hamate. After that, you just have your metacarpals and your phalanges, and that's it for the bones of the upper limb.